Hi, Dr. Ronald Lett again. We're going to look at the same grid except for surgical and obstetrical issues. It's important that you find those patients. Surgery patients and obstetrical patients will be hidden among all the infectious and chronic diseases. So you need to keep your brain functioning. As an expert, you need to think, you need to be alert. In particular, surgery. In obstetrics, you will be able to notice the pregnant patient at least in their second and third trimester. So in surgery, what is low risk? You will see lacerations. Lacerations need to be repaired. They need to be cleansed. They need to heal properly. You will see abscesses, collections of pus. They need to be cleaned. They need to be drained. So these are examples of low risk surgical problems that you should be treating. Often midwives at the health center are the surgeon for that community. So midwives really need to know how to take care of lacerations and abscess drainage. High risk. The high risk is usually obvious. You have somebody comes in a motor vehicle crash. A fracture of the femur. You have a head injured patient that is unconscious. Motor vehicle crashes happen at high speeds. Even if they don't look that bad, sometimes there's hidden injuries. Long bone fractures result in a lot of bleeding. You need to take care of that. You resuscitate them, you send them to some place where that fracture can be immobilized. Head injury with unconsciousness is a bad news story and needs surgical treatment. At least surgical observation. So what's medium risk surgery? You will see a lot of abdominal pain. In those abdominal pain patients, there will be worms. There will be gastroenteritis. But there will also be appendicitis. There will also be bowel obstruction. If somebody with abdominal pain is not getting better with your local treatment in 24 hours, they need to be referred. Head injury. Now, we mentioned earlier that if you have a head injured patient that's unconscious, they need to be referred. But you will have the head injured patient that it's not clear how seriously damaged their brain is. You watch them. If their level of consciousness is going down, if their ability to think is going down, then they need to be referred. So the abdominal pain patient, the head injured patient need to be observed actively and referred when not getting better. What about obstetrics? Low risk. The question of low risk is, who do you deliver at the health center? You want your patients to be delivered at the health center. That's where they would like to be delivered if possible, near their home. How do you know which patient is going to do well and which patient is going to do badly? One of the most important factors is their history. If they've already had 2 babies, that means gravida 3. They're on their 3rd pregnancy. And they delivered 2 of those babies successfully already. The chances that they're going to do well are high. So gravida 3, para 2, gravida 4, para 2, gravida 2, they're all going to do well. So just gravida 2 to 4. If they had no problems, they're probably not going to have problems in the future. Who is high risk? We talk a lot about high risk obstetrics. If they're on their 5th pregnancy, if they've only had 2 living babies out of 5, or 2 living babies out of 4, they are high risk. They should not be delivered at the health center. They need to have a delivery in a center where there's obstetrical capabilities, including cesarean section. Twins. If you diagnose twins, they should be delivered in a center where there is a capability of cesarean section and a capability of taking care of premature babies. So what is medium risk in obstetrics? Some obstetricians like to say there's no such thing as medium risk. And there's some truth in that, in the sense that you never know for sure how a case will turn out. But you cannot send everybody to the hospital. The health center is there to deliver babies. But the baby, the first pregnancy, you do not know how that's going to show up. You can have a very tall woman who can't deliver her first baby. She needs a cesarean. You can have a smaller woman who delivers a baby no problem. So gravida 1, first pregnancy, is medium risk. If they're in labor and they are not about to deliver by 12 hours, they need to be referred. So, obstetrics, it can be looked at the number of pregnancies they have. You can also look at age. Adult women, 20 to 30, tend to do okay. Teenagers, be suspicious. They might not do okay. Older women, greater than 30, may be high risk. Certainly by 35, they are high risk. Now, there are other issues that you can look at, but in obstetrics, if you look at how many pregnancies they've had and what's been the success of their pregnancies and their age, you can have a good idea of whether you should deliver them at the health center, let them labor at the health center, but if they're not delivering in 12 hours, send them on, or say, please, you need to go to the hospital for your delivery. So again, this grid helps you with low, medium, and high risk of surgical and obstetrical problems. We're going to follow this up with another lecture on how to get to low, medium, and high risk. But before we do that, you will have an exercise on how to classify surgical and obstetrical patients.